Welcome to Inclusion Bites, your sanctuary for bold conversations that spark change. I'm Joanne Lockwood, your guide on this journey of exploration into the heart of inclusion, belonging, and societal transformation. Ever wondered what it truly takes to create a world where everyone not only belongs, but thrives? You're not alone. Join me as we uncover the unseen, challenge the status quo, and share stories that resonate deep within. Ready to dive in? Whether you're sipping your morning coffee or winding down after a long day, let's connect, reflect, and inspire action together. Don't forget, you can be part of the conversation too. Reach out to joe.lockwood@seechangehappen.co.uk to share your insights or to join me on the show. So adjust your earbuds and settle in. It's time to ignite the spark of inclusion with Inclusion Bites. And today is episode 124 with the title Inclusive Healthcare for All. I have the absolute honour and privilege to welcome Ellen Edenborough. Ellen and their wife offer bespoke I&D training for health and social care sector people. When I asked Ellen to describe their superpower, they said that they are part of 0.5% of the population, and not many people will ever know how that feels. They like to think that it gives them a unique time on this planet. Hello, Ellen. Welcome to the show.
Hello, thank you for having me on a very early Monday morning.
And you just got back from Spain, Malaga, I think you said.
Mallorca. But it's blue skies in Leeds. Not the same scenery, gotta admit, but still nice nonetheless.
Brilliant. It's lovely to have you here. So, Ellen, Inclusive Healthcare for All. Tell me about what you do with your wife.
So, in Inclusive Health, we launched it January 31st, precisely this year. So we are very new, we're very fresh. And I guess what we do in a nutshell, I guess our tagline is fostering inclusivity, elevating healthcare. So I've done in the inclusion and diversity world now for about 9 years, which really is quite the early start of the I&D conversation in the UK. It still hasn't been around for long. And I maybe we'll talk about it, but I kind of bizarrely found myself in this world, as many of us do, who have been there from kind of the early years. But I've been in I&D in many different sectors, all sectors, worked as a consultant and supported many different organisations, from titchy charities to massive, large global organisations. And when you marry a doctor, which is a good decision and a bad decision, unfortunately mostly bad, but it comes with some perks. I very rarely need to go to my GP because I can get some great advice at home. But you hear a lot of things. And you meet a lot of other doctors and you hear a lot of more other things. And the old organisation I used to work with NHS providers and trusts, but we never could necessarily give those healthcare professionals specialist I&D training in terms of getting some learning and practicing that in a healthcare setting with real understanding. And I thought, wait a second, I've got someone in my house that can help with that. And we just thought, why not give it a go? I think my dad was trying to get me to be self-employed since I was about 18. And I thought, finally, I'll give it a stab. And it's one of those things where you think, I'll give it a go. If it doesn't work, it doesn't work, but at least I've tried it. And look, my wife's a doctor. My wife's a patient. I'm a patient. We're all patients, right? It is the one thing we have in life. And I think COVID-19 was a great awakening call for many that have necessarily not had healthcare considerations or problems in the past, where they thought, it's all we have. All we have in this life is our time and our health. And there's so many people that feel like they can't access healthcare. And of course, there's many barriers people accessing healthcare, but when it comes to inclusion, people's just identity is a massive barrier. With trust, with worry, with fear. And if we can help one patient feel included with a healthcare professional, they have a great conversation. And that means in the future, when they feel a lump or a bump or a worry, then they go back for a healthcare chat or a consideration. It could save their life, and our job is done, even if it's one patient.
There's a lot in the press at the moment about I&D, inclusion and diversity, equity, belonging. But we've seen, I think only this week, and where are we? Middle of May 2024, the UK is pushing back on diversity in inclusion consultants in the public sector body. They're cutting budgets and looking through departments saying, why are we investing in I&D? What's your take on the value that I&D initiatives bring to organisations?
Firstly, I think I just saw, even just this morning before jumping on to call, that civil servants' I&D roles are getting scrapped or pulled back. The NHS budget towards inclusion and diversity initiatives is 0.04% of the whole budget. I think what's quite worrying and alarming is this stuff is life-saving, but people don't see it as that. They still see it side of desk. And I think that's depending on the facilitators that they've had, trainers that they've had. If they haven't got that message across in terms of just the benefit it gives. And look, depending on who I ever speak to, I give them a different sales pitch for inclusion and diversity. For some people, it's people's enough. The fact that they're making people's lives better is enough. For some people, you have to talk about how actually it makes them money. But when it comes to healthcare, I&D initiatives will save money and save lives. In terms of specific, smear programs for trans and non-binary people, going to specific sessions for that, whether it's trying to support people from people of colour and people of communities in terms of donating blood or things like that. It's life-saving stuff. And I think a lot of it's fear. It's fear that privileged groups aren't heard about. And I often can feel an energy. I've even had comments back that, well, I&D is only for certain amounts of people, certain groups of people that are quote unquote minority. I don't like that word. I prefer marginalized. And yes, there is sometimes a time and place to have specific outreach to smaller percentage groups of people, especially when it comes to healthcare, specific testing or opportunities that says, look, it's just for people of this identity because we know they have fears and worries coming into a bigger and wider setting. But the downside to that is when they don't have those spaces, they aren't going to go for healthcare. And it's only going to cost more for the future. There's a really interesting initiative at the moment that the NHS are doing, and it's kind of the first of the kind I've seen. There's something, it's within our household as well, it affects us. There's something in the Jewish community called the BRCA gene, and it's an increased likelihood of getting cancer. My wife has it. Other people in her family have had it. And she sits at around 85% opportunity of getting breast cancer. Unfortunately, as a result of a half-sibling, Anna will have life-saving surgery this year to reduce that possibility. That is an I&D initiative. And there's a new program within the NHS which basically says that they are going to be doing swabs for people with Jewish heritage, Jewish grandparents, to see if they have this gene, so they can do preventative treatment before cancer comes and it's too late. That will save so many lives. It will save so many families and relationships and households from grief. It will save children having their parents in their lives for more years. Like, that's what we're talking about here. And I&D helps everybody. It helps parents, it helps carers, it helps people from different socio-mobility backgrounds. It is not just for certain groups of people, but I think the media are doing a cracking job of saying, Joe, it's I&D is only about me and you. This 0.5%, this 1% of the population. And yes, there's a time and place where me and you need specific time and spaces and health appointments, etc. But it is for everybody. And so much of inclusive health, yes, there's specific things that my wife and from a doctor side is going to bring in from considerations, but she's a trainee GP. She's working hospices at the moment. She's worked in pediatrics, respiratory, you name it, surgery. So much of it is just a communication. It's just asking the right questions. She had an appointment as a GP. Someone came in with an issue with their testicles, and had never been asked about their sexuality and the relationships they had. But from what they were describing, it was vital to know who their sexual partner was, and no one had ever asked. And it was a guy in his late 60s, and they just assumed through fear of offending someone, again, quote unquote, offending someone by asking that question. It was a simple question of, are you sexually active? Who do you sleep with? What parts do you use? That was a vital question to help that person. And that was no extra healthcare in terms of doctor or knowledge. It was just an open-ended question with no fear and no worry. And that really changed the direction that my wife then supported him. And it made things very clear of what those problems could be. That's all it was a question. That's it. That's all we're trying to do.
And that's part of the problem, isn't it? We're lumping I&D, inclusion, diversity, inclusion, equity, whichever the buzzwords you want to use, into kind of activist activities, hashtag type activities, celebration activities. It's the party that's going on, organising these things. It's very infrequently equated to direct action the way you described it there, where what we're looking at is root cause analysis based on people's lived experience, people's inherent characteristics, looking at the inequity that they may be feeling in a process, and then making change to process to make sure they get equity. And that's the I&D good side. So when they're talking about in the news, in the media, whatever it is, about cutting these budgets back, what they're lumping it all together in this wokeness of society, costing loads of money to promote minority people.
Yeah, and again, it's whoever's leading that agenda is doing a cracking job, because I'm sure you're feeling it, as anyone listening that is self-employed. I'm fairly new to it, and people are saying it's blooming different this year. The work is a bit different. A lot of LGBTQ plus people, usually June saves them financially because of Pride, and people are worried, and people aren't getting the call outs that they thought they were going to get. And it's very different from this year to last year. And I don't know what your experiences are with that. So someone's doing a cracking job in terms of having that fear and worry. And again, I think it's that division that we're asking more. And I think a lot of people, that's the message they're receiving at the moment, is that we're asking for above and beyond. We're asking for this and this and that and that. We're just asking for the basics, the absolute basics. A curious question, or if a question needs to be asked and it could feel a bit awkward, just the framing about that. Still ask the question, be like, I'm sorry, I've got to ask this. And, even that awareness of the sensitivity around it, we're really not asking for much. We just want to be seen. And I know this sounds silly and a bit of a, I was just speaking to you before we joined this, that I've just been away. We never book a hotel because of fear and worry. I've had top surgery. I've got 2 scars on my chest. I want to swim in a pool. I want to lay out. And I worry about how people look at me or perceive our relationship. So we always have to spend more on booking somewhere private for us. And when we booked it, we mentioned that we were celebrating our anniversary to basically see how the host will feel about us, to get a vague idea, to be like, we're just putting it out there, we are LGBTQ+. And she gave us a bottle of Prosecco and said it's your anniversary. And she remembered months later. That I felt so seen and acknowledged in an island I've never been. Even that was massive, even just to be like, I see your relationship and I appreciate it, meant everything.
Yeah, I hear that, see what you're saying there completely. And I suppose I'm old enough and ugly enough and resilient enough to not even think about that anymore. My wife and I were in Bournemouth for a party weekend. We checked into the hotel. I didn't even give it a thought there'd be a problem. I guess I've traded off more than 50 years of life going around, staying in hotels. And the thing is, I don't think I've changed. Obviously, I look different to other people, and our relationship with my wife has changed since my gender transition. But I don't feel different inherently. So I forget that I should have a problem, and therefore I don't. If that makes sense, I've never socialized myself into that sense of self-doubt, which means that
I wonder
I don't
if
see the problems.
Without getting, I feel like I'm going to take you off on a tangent now. I wonder if there's an element of, I was raised as female on this planet and didn't really acknowledge my non-binary identity until kind of mid-COVID. So for many, many years, I identified as a woman on this planet. And with that, you are very aware of certain things. I had top surgery coming on 2 years soon. And I can now post my nipples on Instagram, which was a really weird feeling because for years I was told I couldn't do that. And now I'm like, oh, my nipples are on the internet. And I know that sounds ridiculous, but like I was told for years to hide myself of what I could and couldn't do in society. And what's really fascinating is I used to get misgendered as a man a lot before my top surgery. And I've never had it once post top surgery. So I'm now flat chested and I've never been misgendered as a man once. And my wife thinks it's because I don't hold space. I still, that classic thing of men don't move out the way in pavements. They'll, they won't move out the way left or right. They just walk in a straight line. My wife's really determined that now we walk in a straight line. We don't move out the way, but I still do. I don't take up space on the plane and spread my legs wide, as I saw a man doing the other day, and a woman felt so uncomfortable she moved because it was a half-empty plane. I'm that conditioning of me growing up of the space I should and shouldn't take. I think that plays in my mind when I still go on holidays because I've still got that fear and worry. I think there is on the plus side, to other people in the community. Some people may not see me as non-binary, right? They still might think I'm a butch woman. But there's a privilege with that because of the acceptance of tomboy and masculinity. It's more accepted from that side than it would be someone who identified as male but wanted to dress quote unquote more feminine. Wouldn't be as accepted, So there are ups and downs, but we often look. We didn't book a honeymoon for quite a while because we couldn't decide where we wanted to be. Because we think about we're also very aware of our white privilege, There was a friend of mine who went on a honeymoon to a country where it's illegal to be LGBTQ+, and I thought, what are you doing? Just because you're safe as a tourist on that resort, you're giving money to a country that if you were born there, you'd have a very different life. So when we book a holiday, it's not just where's the weather, where is it nice? It's where will we be okay as tourists? Secondly, where would it be okay if we were born there? And, Spain is now 5th in Europe in terms of being LGBTQ+. We're now 14th as a country. So I was probably safer in Mallorca than I was here, which is quite scary when this is home.
Yeah, I know exactly. We went to Melbourne, Australia, before lockdown, and I was very conscious about the route we took. I didn't feel comfortable stopping off at Dubai mid-route or flying Emirates. So we ended up going via Hong Kong because I decided Hong Kong was the least worst option to transit through. I didn't want to go through China, didn't want to go through Emirates. And I was very conscious of that. So I am about where I can go. I was born in Singapore. I know that Singapore has now changed its law and it's very much more LGBTQ friendly. But where I lived was in Malaysia, which is over the causeway. And in Malaysia, it's still punishable by death, I believe, if you're queer, maybe trans. I don't know. So certainly as a same-sex couple as we are now, that would be frowned upon. So yeah, I'm hyper aware of my ability to travel is now different than it was.
Oh, and I was at a barbecue yesterday, and someone I know is moving to Australia because of her partner's job, and they were talking about flying with Qatar and stopping in Qatar, and I'm just like, you don't realize. And she is within our group. There's loads of LGBTQ+ people, loads of non-binary and trans people. And look, I appreciate to get to Australia, there's only so many places you can stop and go, and so many airlines. But I see a lot of people just going to Dubai, and there's numerous things going on over there which aren't great. But yeah, it's. I think being LGBTQ+, being trans, being non-binary, you're so aware of your body in every space to the point where I don't think we realise just how traumatic and heavy that is because we're just so used to it.
Yeah.
But I would.
That's interesting what you say about your nipples. I mean, I'm more conscious about my nipples now. That I used to walk on the beach without a shirt on, and now I wouldn't do that. And and you talk about minimising. And whilst, as I said, I'm old enough and ugly enough and resilient enough, but I minimise. I let people pass on the pavement. I will walk out of the way. I will stop and let someone, often a man, pass. And if someone opens the door for me, I accept it with grace. And the other day I was checking into a hotel. There's a big staircase, and I got up the first step, and this man comes and says, "Oh, excuse me, let me take your bag upstairs for you." I went, Great, brilliant. How validating is that?
You see, when someone opened a door for me and it's a man, I'm always like, nope, you first. And make a point of making them go first. But yeah, it's interesting, isn't it? Like the difference of how we're experiencing a similar but different journey.
Yeah.
I'm very aware that we're now talking about nipples, which is probably what you were expecting on a Monday morning.
No, honestly, I've talked about all things on this. I've talked about trans healthcare and surgery before, and we've got very detailed in what that means to people. So, yeah, no, it's important that these conversations are had, because we shouldn't be embarrassed, and that's what happens when we look at conversations around things like menopause. They've been buried for years. We now need to have those conversations about menopause with an intersectional gender diversity lens on them as well. You know, the intersect of people who are non-binary and trans feminine, trans masculine people.
Yeah.
Which is blowing people's brains out. They go, wow, I thought I had menopause sorted, but you've put another dimension on it for me. And then we've got to talk about gender neutral packaging and taking the femininity imagery away from period products, and the whole gynecological kind of process is excluding, people like yourself, people who are transmasculine, who have needs for these services, and we're not careful what we're doing to excluding people through the language we're using.
I mean, I'm turning 29, so I've had my second smear now. Because of my age, it starts at 25, and first time was COVID, and I had a mask, and that anonymousness helped. With going for that at the GP, but this time I chose specifically go to an LGBTQ plus kind of sexual health partnership in Leeds, as a charity that works with the sexual health clinic, and they do a specific trans and non-binary opening session, so you feel acknowledged straight away, and only questions will be asked in a considered way. But what's ironic is I'm also talking to my GP at the moment and trying to help them with their kind of trans policies and training and stuff. And I was still getting calls from them with Miss So-and-so. And I'm like, why do I need a title? Also, I've been told, I got a call a week too later after being at the GP, and they say, oh yeah, I can see you've had that and it's come back negative. So why are you ringing me again? And then that misgender, like, why can't it be, hi, is this Ellen? Like, again, people think we're being nitpicky, but lots of people don't like titles for lots of different reasons. We have our first name for a reason. And again, why do we need pink packaging for every sanitary product? Just a packet. Like, it so much. It's like with disabilities. There's that famous little cartoon image. It's been snowing. There's snow on the steps and there's snow on the ramp. And they scrape the snow off the steps first. But if you just do it on the ramp, everyone can use it. They was talking about, if you think about on streets in the UK, the ramps that go down with the bumps, that's for people to use to see where the end of the roads are. But it helps people with prams. It helps people that are elderly, maybe just use a stick with mobility or for different reasons, mobility aids. It doesn't just help people that are like a wheelchair users. It helps so many more people, and that's inclusion and diversity. When we're changing these policies, we're not doing it. I've looked at so many policies and given suggestions. It's completely intersectional. It's considering, it's advocating for fathers, it's advocating for people that adopt and carers of all different ages, because caring now, I think so many people have just assumed it's people with children, but we think about the aging population. We're thinking about kind of millennials are now caring for their parents and loved ones. I've always seen it from so broad, even with inclusive health now. I think there's a lot of LGBTQ plus people who do just specific LGBTQ plus training and things like that, but we really wanted to broaden it. Don't get me wrong, I think, as you've kind of hinted, with things at the moment, the most inquiries we are getting are LGBTQ plus with healthcare at the moment. And I guess for anyone listening who is LGBTQ plus, who has loved ones that are LGBTQ plus, you're hearing certain things in the media, but I promise you there's more people in healthcare that are trying to advocate this stuff than you are being told to believe. We are still getting a lot of interest from trusts, from healthcare charities that are wanting to be proactive with trans and non-binary patients. So try and not take everything. So, for example, the NHS Rainbow Badge, for those that are listening aren't aware of that, You might have seen the badge. It simply started as a project in which you just wore a lanyard. You put this badge on it that basically hinted that you will be considerate of LGBTQ plus people. It then became a bit more formal, and people can do now a bit more looking at the data and what services they do and don't provide, to wear it with a bit more pride and reassurance of patients. And we've been told in LGBTQ plus History Month in February it's been scrapped. It hasn't fully been scrapped. It's still happening. It's just happening in a different way. So I'm also not saying everything's wonderful in the healthcare, but there are a lot of people with reduced budgets, with reduced time. They are still trying their very best with this conversation. And every trust is different, and every trust can kind of do their own thing. So if that's kind of reassuring to anyone listening, I promise people are still caring about this stuff.
Yeah. What you see in the mainstream media that is right of centre isn't necessarily. We know it's sensationalised. We know it's blown out of proportion, but it is worrying that the pervasiveness of this kind of negative messaging is exhausting. I mean, you probably feel it. Maybe it's because of the way I set my search up. Whenever I open things like MSN or these dashboards, or the negative articles I see day in, day out, and it's like a torrent. You know, it's almost like every time it's like, oh, here we go again. And also, I don't know if this with the trans communities, and I hate, we're not really a community, we're just a group of people who happen to share the same oppression. That's kind of what goes on. We amplify the negative stuff as well. Have you seen this stuff on there? Have you seen? I get more negativity out of some of the transgender forums I want on Facebook than I do if I didn't go on there. So I think to a certain extent we are impacting our own mental health by amplifying some of the content within our own communities. And I think that in a way, you got to put the filter on sometimes and not dive in there.
Yeah, I mean, look, it's been an interesting time to set up this business with my identity of being non-binary, and with the news in literally the past couple of weeks. We've had the CAS report come out. We've had news that they're thinking about doing private rooms for trans patients. Supposedly, again, I heard literally just 2 weeks ago that new hospital designs, they're looking at giving everyone a private room rather than the ward thing. So, that could be the future of that anyway, which again, I think would benefit everyone's health, privacy.
I sense the news about, they want to keep wards single sex. And if you turn to a trans person, they're going to put you in a private room. I was thinking, where's the downside to that? I mean,
I'm not going to lie, I'd prefer to, but it depends, I guess, where those private rooms are connected to, if they're in like a women's section or a men's section, etc. And
I had my gallbladder out during COVID. Actually, I had to be swabbed and stuff, and they let me in, and they wheeled me into this female ward, and then 30 seconds later they wheeled me out and said, "Oh, you shouldn't be in here. This is a women's ward." And I went, "Yeah, and where else will I go?" And so I started trying to question this person pushing me out the room on the trolley. And they backtrack quickly and say, no, it's because you haven't had your COVID swab yet, so we can't put you in there. I went, okay, that's a better answer. I'm happy with that answer. So we're going to have to put you in a private room. I said, I'm really happy with that answer as well. You can leave in this private room where you like. So having experienced the confusion by the staff around who I was, I don't think I'd even spoken at that point. I mean, they must have, I don't know, maybe I decided my brow ridge was the wrong shape or something. So they decided who I was without asking me. But yeah, I think if we're going to put people in private wards, we haven't got the capacity. And what it's doing is creating this fear mongering around, you've probably seen this, is stats and data and freedom of information requests. There hasn't been one complaint by a cisgendered female about a trans person being on that ward.
Yeah.
There's been more complaints around people who have a different ethnicity or faith complaining about other things related to their ethnicity around something that isn't gender related. And you think, we're making this stuff up. We're making these facts up to scare people where no problem actually exists.
The most scared person on that ward will probably be the trans woman. I'm regularly scared to go to the toilet. If I have to go into a toilet, I always try and talk as I go into the toilet so people can hear my voice, so I don't get as much of a look. And again, that makes me uncomfortable because that's not how I want to be represented and look and feel. But there's so much. Again, it's a terrible quote, but there's a rapper in America called Macklemore. It's not a great reference. It's not like some incredible author. It's a rapper, but he says, "America the brave still fears what it doesn't know," and I think it's so true. People fear what they don't understand. We are ish 1% of the population. So a lot of people think they've never met a trans person. They have, they've just not known it because they think we all look and sound and have to be a certain way. And as we know, that's not the case. But people just don't understand. And I think sometimes, you know, for those listening, and if they have any budget with Pride, or they have an allyship or a privilege angle that they can get a speaker in or something, just try and get someone trans and non-binary into your organisation this year, and just get people to unlearn some of their assumptions. We're just people wanting to go about our lives, who want a healthcare appointment about a bad back or a bad shoulder, who want to fall in love, adopt a cat, adopt a dog, have mates, have a job. That's it. That's all we want. We just want to live. And I can't wait for the trans community to stop being in the news and it just be a bit more quiet. I probably have a cry on a weekly basis, and I just think I just want it to be quiet. It just feels so loud. You know, there's incredible stats of newspapers doing 2 or 3 articles every day about trans people, and not one trans person writes them. I'm like, have you got nothing else to talk about? Like, the trans community right now are like, please talk about anything else. Cost of living, conflicts that are happening globally. Like, that's more important than us. We actually don't want this attention. We don't want this focus. And again, I think a big thing with inclusion and diversity, yes, the training's important, but sometimes and I appreciate some people are not sure about inclusion and diversity dates and calendar. They think it's tick boxing, but there's something to be said for showing joy and celebration and normality. You know, just seeing people like me and you living their lives in happy relationships with families and loved ones, and just be like, we're normal too. We're not as scary as people make out. That's so valuable and so important. You know, showing Black joy, showing disabled joy, you know, just showing how people live their lives, and they're not scary. We're not scary people. You know, trans and non-binary people have a really interesting outlook on life and the world. And I think we're possibly some of the bravest people globally, because we have gone against everything we've ever been taught. No one ever taught us what trans was. Section 28 stopped a lot of people in terms of their education, and prior to Section 28 just wasn't around, and we're still seeing the impact of Section 28 in terms of education, right? We were never taught this stuff, yet we still deeply feel it. You know, I am very proud of being LGBTQ+. I love being gay with everything about me. But at the moment, I think I would, if someone said, if you could click your fingers and be straight, would you? Absolutely not. I love everything about being LGBTQ+. It's incredible that you meet people and you feel a connection to them instantly, like no one else. It's that little look you give each other, being like, I understand you and you understand me, although we've never met and I don't know your name, but we just get each other a little bit. But I think I would change non-binary at the moment if I could click my finger, just so I could just stop feeling so much at all turns and all opportunities. You know, you can't welcome a plumber into your house without fear or worry of misgendered. You can't go to Tesco without fear or worry. You can't go to the park or say hello to a dog walker without fear or worry of just that misgenderedness constantly. And, you know, it's everywhere. And that's how I came to terms with my identity during COVID. We had these 4 walls, and I thought, who the bloomin' hell am I to the world? Like, how do people see me, and how do I want the world to see me? It was only when I wasn't out there in the world constantly, possibly hiding who I was, that I could start being who I was, because without fear or worry of other people. And I think there's something incredible to learn about trans and non-binary people. I think a lot of cisgender straight people could learn from us in that. I think a lot of people, the boxes of femininity and masculinity, they just feel like they have to fit in them because they've not been told that they can do anything else. And I think people could learn a lot of just life skills in terms of attitude and outlook of just being authentic and brave, because we're incredibly brave people. We shouldn't have to be, but we are.
Yeah, it takes a lot to press pause on your life, rewrite it, and then press play again. And it's like you're swapping track in the middle of you're fast forwarding to another part of the album, starting to play again. You go, hang on a minute, all the beats are different. I was just humming along to that tune, and now it's all changed. It's like, it is. And those around you, I often talked about my transition was more about other people than it was about me. I kind of transitioned by spinning on the spot. Everybody else had this huge arc to get over, to understand, to try and, the world didn't change from my perspective. It still looks the same.
And what's crazy is you didn't change. You were still making the same jokes. You were still having the same opinions, like maybe just an outwardly look change, but that was it.
I've had this conversation with my wife many times, and she tells me not to be so disingenuous that I haven't changed, because I have changed a lot. My whole outlook on life, the way I interact with the world is different. The way I take up less space is different. Yeah, I am a very different person, but that's through a lot of circumstances, not just expressing my femininity. So I had to stop saying to people, I'm the same person on the inside, because people kept looking at me and saying, that's a load of bollocks. You may think you're the same person on the inside, but we don't see it. We don't see it at all. And it's not just how I look; it's how I am, which was very affirming in a way.
If you don't mind me asking, because we kind of hinted on that earlier, didn't we? In terms of me taking space and us thinking different things in different settings and holidays and outlooks. Do you think that was something you were aware of before transitioning? You had that awareness of that outlook of how other people experience the world, and you felt like you couldn't go down that path because that was not what the world expected of you, or was it a real unawareness?
I think I became re-socialized, and I often say that the challenge with transitioning, when you're growing up, you learn and you learn, you pick up information, but when you transition or become non-binary or out yourself as non-binary, you have to unlearn and then relearn. So you have to forget some of the social constructs you've been brought up, the oxygen you breathe, and relearn again. So I had to unlearn a lot of things I'd been aware of, and because most of my professional network and the people I hang out with tend now to be women, I'm picking up the social construct of being female from them. And that is around minimization. It is around the jokes, the humor, the conversations, how men are talked about and how women are talked about by men. I'm more aware of that. I'm more aware of and I don't mean this in a nasty way, the predatory nature that men often have without realizing it. And they're not being deliberately, but I feel less safe in those environments. I see what happens when groups of men get drunk now. And I'm more aware of my safety than I ever was before.
Right.
So yeah, I am more aware of that, and I'm conscious of it, which I was never conscious of it in any shape or form before. I was sat at dinner, at an awards dinner, probably a year ago, and it got to about 9:30 in the evening, and a couple of the women I was sat next to said, "Oh, 9:30. Better think about going in a minute. It's going to get messy in here. There's drink flowing. I don't want to be on the last train. I've got to get on the underground. It's a bit late, and I'm a bit worried if I leave it any later, it's going to be too late. I need to get out of here and get home." And there was a real safety thing going on. I just sort of thought, wow, that level of socialization has never been in my head. I've never thought, uh-oh. But then, having said that, I've been on the late trains home some nights. I'm thinking, I actually feel very worried now. Yeah, there was a drunk person talking to me a bit, and then there was some stuff going on. I thought, hang on a minute, I feel really, really unsafe, because somehow I then internalized all of that, thinking, hang on a minute, something kicks off here. I'm not prepared to deal with this. I don't want to deal with this. So I became very aware of my own vulnerability all of a sudden.
Yeah. And again, I think that can happen to people for different reasons at different times in their life, but it's a really unique experience at such a grand level for trans and non-binary people. I have a really interesting privilege when it comes to kind of things we've just been talking about, in terms of, look, I came out at 14 as gay, 15. from the age of 2 or 3, I was saying to my mum what I wanted to wear and not wear. Like, I very much knew who I was before I was taught or learnt anything in society. I mean, there was no representation, but I still knew I wanted to wear that Buzz Lightyear t-shirt and not that dress from like 2 or 3. And I've always been quite butch in my identity, had quite short hair from quite a young age. And there's not one woman I don't know, trans or cis, that hasn't had an experience of some kind of assault, sexual assault. And what's fascinating is that I never have. And I think it's really interesting when we talk about sexualization. I think because of my butch identity, and I'm sitting down, but I've got a bit of a butch walk that I don't even realize I have. I've never really been sexualized. Now, the last time I was kind of sexualized was the last time I ever wore a dress. At university, I was in a hockey team and there was like a sports night and I wore a dress, and that was 2013. And some of my male friends, what was interesting is barely any of the men, there was like 6 hockey teams on the men's and the women's side. It was very binary, obviously. And barely any of the men were interested in talking to me because I was the only gay out person. So that I was never going to be someone they were going to possibly have any relations with. So barely any of them got to know me. And I really noticed that compared to everybody else. No one ever really spoke to me. But there was 2 or 3 that still got to know me. And they changed that night I was in a dress. Their whole approach to me changed, and I never wore a dress again. I still worry and fear, late nights, walking down certain alleys. I would still avoid, and I still check in with my friends. But because not many men would be sexually attracted to me, I feel safer, if that makes sense. So I've grown up that way, and I've been taught that, and I've been around many conversations. I've been really privy to so many people's experiences of it's getting dark, and I've been really aware of that. But I'm in this really bizarre privileged group. It's a really weird slither of, because of my masculinity, I feel safer. That I won't, but there's still the worry that I'll get the non-binary transphobia side of things, but in terms of my body. And then that's really interesting because you kind of mentioned surgery earlier, and a really interesting reflection for those that don't know. So I had top surgery, had my breast removed, and I went private because the NHS, it would take many, many years, and my mental health couldn't cope with that. And I had to pay for a psychiatrist appointment. So I had to pay for a stranger to speak to me for an hour to agree with how I felt about myself. And was ironic that he barely knew what non-binary was, but he was supposedly the professional. And I remember he would ask me to repeat things in our call because he's like, "Oh, I'll write that down." I basically wrote my own referral letter that the surgeon needed because the surgeon was worried about being sued and things like that. And it's kind of they don't want to do that, the surgeons, because I think they have a really good understanding, but there's so much fear and worry at the moment they have to have that. And I thought was really fascinating is because I was removing something that society has sexualized, I had to be psychologically evaluated, that if I was okay. But if you want a bum lift, if you want a nose job, if you want filler, if you want a boob enhancement, none of that is done. People get their knees operated on to be taller, right? A lot of cisgendered men have these operations to get their, hairlines done to make them feel more confident in their gender, right? So many people do so much stuff. I think it's just trans non-binary people that say we have gender-affirming healthcare, which old language was things like sex change, but gender-affirming healthcare is basically the idea that people do things to feel more confident in their bodies. And cisgendered people do that too. Getting your nails done, getting your hair done. We all feel better after a haircut. People get filler because they're worried about their lips, or Botox because of their wrinkles. Everyone does gender-affirming healthcare, Yet because I was removing something that's sexualized, I had to be evaluated. But people can change their bodies in many different ways, and that doesn't need to be checked. And again, that's the sexualization that comes in with healthcare, which is really fascinating.
Yeah, I think we have to respect the fact that there are some people who transitioning, either binary transitioning or non-binary transitioning, is not right for them. We have to accept that it's not right for everybody. And I'm the first one to say, if you don't need to, don't. It's not a party. It's not one long gay parade that you're riding a wave of unicorns and fluffy stuff all the time. It's real life, if you don't need to, it's not necessary if you don't do anything. So I'm hugely respectful of people who have evaluated their life, their needs, what matters to them, and it's not for them. I'm hugely respectful for that. And I also believe that everyone should be given the opportunity to be in that questioning phase of their life for however long it takes, and move forward or move backwards or move sideways or do what they want. So I'm extremely protective of that right. But yeah, it does become problematic sometimes when we're focusing on the significant minority of the minority who are litigating against healthcare professionals, claiming that they were forced into a route when inevitably, actually, they must have lied through their healthcare evaluation in order to be taken seriously. I've been through psychiatric evaluations to get hormones. I've been through psychiatric evaluations to discuss surgery and various other things, and they would only put me through if they recognise that I understood. I have informed consent. I understand the implications. They're quite clear. This could kill you. That this could cause irreparable damage. You will never be able to reverse this. You will never be able to have children again. Yes, I understand all of those things. Yes. So you go through this really deep thing, and it's not just once. It's I think I've had 7 gender identity clinic appointments to get to where I am, and they ask very similar questions. And it's not like they're week in, week out. This is like years between them. I have to be very pervasive. I can't just sort of say, oh yeah, I want to do this next month. I can't. Right. I have to think, I want to do this next decade.
No one would, if we had choice, no one would do this. We spend a crazy amount of money and time and energy, and we have to be so vulnerable. No one goes into this stuff easily. It's not a whim decision. Oh, I'm going to go on holiday next week. Like, this is stuff that it's months, it's years in waiting, even when you pay privately. It's not an easy decision to go under the knife and have major surgery. It's not something I just thought, oh, I fancy having a bit of time off work. I'll go and have major operation, loads of muscles cut. And, it's not something, and there's some crazy stats have come out. Let's see if I've got them quickly on my phone. But in terms of how many people regret surgery, it is so slim, and I can't find the stat, but it's such a small amount. More people regret having children.
Less than 1%. Less than 1%, yeah. People regret having a haircut.
Right.
More. Yeah. Having a treatment. Yeah, you say I had a referral with a psychiatrist around considering my future options of where I wanted to take myself. And one thing they said, which I thought was really weird at the time, was think about yourself in your old age, when you're then in a care home, in a nursing home, whatever. How do you want to be? Who are you at that point? And I thought, and he was encouraging me to think about the choices I made based on my later life. And I didn't know anything about it. I thought it was a bit cheeky and a bit transphobic the way he was talking to me. But I've recently, in the last 18 months, been thrown into the sandwich generation where we've been looking after our parents, our elderly parents in their late 80s and early 90s, in care homes, in nursing homes. And it made me realize that if I want agency over myself, I have to make those decisions today, because when I get to that point in the future, I will have less opportunity to advocate for what matters to me unless I've made those proactive choices now, not later. And it really made me realize around some of the things I have to do for my advocacy and agency and self-empowerment later, not for now.
And I had a similar moment, but a reflection, a question to myself, in terms of when someone asked that to you about what age and what situation, who and how do you want to be. I had that with, if we have a child and I want to have skin on skin because I don't want to carry, how do I want my body to be? And I would feel like my baby wasn't close to me if I didn't have my top surgery. Even my mum, like, after seeing me out, bandages off the first time, was like, I wish I could have ordered this for you because it makes so much sense, and part of her upset and worry about my surgery was, of course, seeing your child go under major surgery, you worry and fear, as with every operation, there's risk. But she was upset that she'd brought me into the world in a way that I wasn't happy with myself. And that was her upset. And I think what's interesting, secondly, is what you're talking about there is my work in the hospice at the moment. At the start of the year, we had our first, my auntie was in hospice, and there was a lot of ableism with her care, with her learning disability, and that's an inquest at the moment. And we're looking at working with that hospice. And it really, that is it's something we're all going to experience, right? Is death. Unfortunately, only a small amount of people experience hospices, and I don't know if you've had experience hospices, but they're beautiful. Like, they're incredible. Everyone, if they can't die at home, deserves to die in a hospice, because it's also so vital for everyone that's left. Because that's what happens after, and those people that are left, like, hospices are incredible. I actually missed going in, which is a really weird thing to say, but the next day after my auntie passed, I was like, I want to go back. They also had great hot chocolates, but I missed it. And we were thinking recently, like, if that's me, even if I'm at a space where, I can't hear and I can't understand things anymore, if I'm getting misgendered in front of Anna, my wife, like, that will hurt her. Like, that's healthcare. It's not just the patient, it's also those around them, seeing them, hearing them, seeing their relationships. If you got a loved one at the side of the bed, not being like, oh, is your husband coming in? Like, don't assume that. There's already enough going on. It's just going to make them feel like they're not heard or seen or respected. And I know there's that assumption, but don't assume. It's 2024. We can still ask open questions. And that's healthcare. Again, so much what we want to do with inclusive health is, yes, there's there needs to be improvements when it comes to medical students, in terms of the images that they see, for skin cancers, it's always on white skin. Like, that needs to be advanced, that needs to be improved on. But it's just the questions and the considerations that can change things. And it's just the tone and the approach that's the trust. That's the bit where trust comes from, isn't it? As a patient, because you're so vulnerable with your healthcare, right? Like you were saying, you just got wheeled out. Like, you were laying down, like you couldn't stop it. There was no breaks for you. You're really vulnerable in healthcare because it's other people prodding and poking you. And I feel so lucky to have Anna to advocate for me, who knows this stuff. But when you don't know healthcare stuff, you're really putting your body on the line for other people to make decisions about you. And you lose all of your own self. So if I have someone else to also see you when you can't make the decisions or even that's vital. And that's what inclusive health is about, is just saying, look, have that awareness, have that acknowledgement, because if you don't, this is the impact. We saw more people of colour die during COVID. There were several reasons for that. They were more likely to have front-facing, public-facing roles that put them at risk and stuff. But it was the comms, it was the messaging, it was not acknowledging what fears certain communities had over medicalised spaces. Because think about the colonialisation of healthcare in the past and, not having that awareness. You don't have to understand everything with I&D. To be an ally, as I'm sure you'll admit, Joe and me, I do not know everything about inclusion and diversity. It's blooming impossible. There's 8 billion of us. But you can understand you can respect without having to understand everything. I can respect someone's faith, but I don't have to understand every single bit of the Quran. But I can respect that person has that, And there's good and bad with everyone. There'll be bad trans people. I don't like to admit it, but there will be. There'll be not some very nice trans people. There'll be not some very nice disabled people and Muslim people and X, Y, and Z. But there's more good than bad. And it's just humanness. It's just seeing a person. There's always so much more in common than not.
I'm a big advocate of what you say. I have an inherent belief that people start off wanting to do good, wanting to be kind, and in their mind they're speaking through their lived experience, their lens. They believe they're doing the right thing, and it's just that their perspective, their opinion is slightly different to mine. But we all want the same thing, as you say. There's more that unites us than differentiates us. So we've got to focus on the fact that actually we all want the same thing: happy life, health, world peace. We all inherently want that, and we think we're doing it in our way.
Yeah.
And it's avoiding sort of weaponizing or discriminating from our own self to somebody else and putting somebody else's down for our benefit, if you like. So yeah, it's that's all that I&D is around. It's around creating a culture of belonging. People feel welcomed, they feel celebrated, they feel they can thrive for who they are, and people will spot any inequities and give them the support they need to be able to succeed in that. And I think that's fundamentally what we're talking about here, isn't it? And it's not about hashtags and parties and cakes and banners and marches and changing language to make people feel uncomfortable. It's just creating I always talk about additive language. I'm not sure that's a word, additional language. So it's not, you're not removing the word mother and changing mother for child bearer or whatever the words are. It's saying mothers and recognizing there are other people who don't identify as a mother, not taking away the word mother, just making sure the expansiveness of the language being used encompasses everybody without creating an other. We don't want to be othered. We want to be anded.
It's a bit like
and not or.
It's a bit like all that fear. I mean, quite a few years ago now, it was kind of a big one. Oh, primary schools can't say Christmas anymore. And there was this all this fear, and it's like, oh, we can't say Mother's Day anymore. No one's blooming saying that. Like, these communities are actually saying that. It's just, I saw recently that nearly 60% of all journalists are privately educated. Even just that in terms of their understanding of the world and their experience of the world when they're writing from a journalist point of view is wholly different to the majority of the population. That's only one angle of a person's background and awareness. It's just, to anyone listening, and look, the most people listening to this will be people that already get it. But all ads, and unfortunately, but there'll be people, and we all have family and friends who maybe don't get it to the same degree. And it's just opening their eyes to be a bit more critical to what they're seeing. They're especially, again, and this is the importance of allyship, 99% of people are cisgendered. Us little 1%, we have done a lot, don't get me wrong. It's actually quite incredible, the coverage of our movement. Yes, it doesn't seem positive right now, but the handful of people that have got that story out there and that language out there, it's rather remarkable what they've done. But we can't change that anymore for us now. We now need the 99%. And that's in boardrooms, that's as a manager. The women's movement can't change without men. The LGBTQ plus movement can't move without the straight community. And that's that importance of allyship. We're here. So allies listening right now, book an LGBTQ plus person. Doesn't have to be in Pride. It could be another time. We don't have to talk about being LGBTQ plus. We can talk about other things, recruitment training, whatever it is. But having an LGBTQ plus voice and just normalizing us is vital. Giving us a platform, and that's also really important. We don't always just have to talk about this. We can talk about other stuff and show that awareness. But there's a time and place for us to talk about this too. And yeah, this stuff benefits everybody. But I do sometimes wonder, do we need to change the language? I appreciate it was ED&I, then I&D and D&I, and it always changes, but it's got such bad press. Do we need to rebrand? What? Don't ask me what to, but do we need to rebrand to make people realise that this stuff benefits everybody? When we're looking at menopause policies, we are editing it to change it and help everybody. Perimenopause, for example. Wasn't really a thing that it was always assumed it was people of a certain age. We're now realizing that isn't always the case. Endometriosis and how that impacts people. We're not always doing it from one angle. I'm sure that when you look at things, you're seeing it from many different angles, even though you've maybe nobody asked or paid to do it from one angle. You think, actually, I've also seen this. I'd recommend this. We are trying to just help everybody because especially, moving to self-employedness really, and COVID was a great realization that a lot of people spend more time in work than they do with their loved ones, especially those that are still forced into offices. That's a lot of your life. And at the start of this podcast, I said we have two things in life, time and health. It's really all we've got. And that was a choice for me to become self-employed was, I appreciate I'm only 28 and maybe COVID, I had an early realization. Some people don't have that until later life. And I was like, all we have is time. And I feel very, very vulnerable with my health because sometimes there's things that you can't stop it. You can't prevent it. We can look after our bodies as much as we can, but it's a blooming lottery, isn't it? If we have good health or bad health, and we never know when that's going to come, but it's a really vulnerable thing to be at. So again, if inclusive health can change one health professional of how they see something or assume something in later life, if that could save a life or build trust for a future life-saving thing, you don't know what impact that's going to have. And so much of allyship is you never get a pat on the back with allyship because you might never know the outcome of your actions or your words. But I promise you, people will feel it and will experience it. And I remember I did some training for a new job to a random organisation. I can't remember who they were. And I got an email the next day from someone that was on that call that said, I joined your session yesterday. I went home and at dinner I spoke about what I'd learnt. And that night my son came out to me. And I basically thought, well, that's my job done. I could retire now. Didn't have the money to retire. But I've maybe helped one little boy's mental health in that he feel like he can say who he is to his family. He can bring someone home that he loves. That family maybe have a better unity in the future as a result. That's life-changing. To several people, that could be life-changing. Thankfully, they emailed me and told me that, and it stayed with me, and it always will. But you may not get that email, but just know that you feel it. Our Airbnb host gave us that bottle of Prosecco, probably didn't realise how much it meant to us, but that'll stay with me, that there is hope.
Ellen, thank you. What a conversation. I've really enjoyed this. How can people get hold of you? Tell us about your company website, your LinkedIn profile. How do people get in touch?
Yeah, so we're on www.inclusivehealth.co.uk. You'll find us there. On shock horror, but not many people have the name Ellen Edenbrow. I'm definitely the only one on LinkedIn with that name. We're quite a rarity. So do check me out. I'm there to find. Also Inclusive Health on LinkedIn. And look, at the moment, we, as you'll probably know, Joe, when you started this stuff, we're putting ourselves out there. We're not sure where we're going to go and how we're going to get there. And we're kind of reacting to what people want. Every charity, every trust, every organisation wants something different. We're doing it bespoke to what they need, their needs, their wants. I'm also looking at building my own website at the moment, Ellen Edenbrow, because, as I said, I've worked in private sector, I've worked in charity sector, public sector. I've consulted with 28 businesses for 2 years on everything that they're doing. And it's just, again, it's talking about recruitment. It's talking about law. It's talking about your banter and your bullying, but just having someone that's trans and non-binary, giving that intersectionality and putting that out there. But we're really excited with healthcare, and it's really exciting to see. I'm doing a session soon and supporting people that give group and support to young people that are in families and communities with drug and alcohol abuse, and supporting their LGBTQ plus service users. And the power of that's incredible, of who that's going to help and how that's going to help. We're talking to hospices. So just giving people dignity to their healthcare.
Thank you once again. As we bring this conversation to a close, I want to express my deepest gratitude to you, our listener, for lending your ear and heart to the cause of inclusion. If today's discussion struck a chord, consider subscribing to Inclusion Bites and become part of our ever-growing community, driving real change. Share this journey with friends, family and colleagues. Let's amplify the voices that matter. Got thoughts, stories, or a vision to share? I'm all ears. Reach out to joe.lockwood@seechangehappen.co.uk and let's make your voice heard. Until next time, this is Joanne Lockwood, signing off with a promise to return with more enriching narratives that challenge, inspire, and unite us all. Here's to fostering a more inclusive world, one episode at a time. Catch you on the next bite.